morning. We are here this morning at Sleep Solution Centers in Lake Nona, Orlando, Florida, right in the heart of Medical City. We have Kevin with us today, and I wanted to share a little bit around Kevin's journey, and actually, more importantly, I wanted him to share around the journey that you had. So, Kevin is a veteran. Happy belated Veterans Day.
Thank you. Thank you for that.
Would you please share with us your history, as being a veteran, and also about how you found us?
Sure. My name is Kevin. I'm retired Air Force, 20 years in the Air Force. I had a really good career. I slept well, and toward the latter end of my career, snoring started. I started snoring a lot, and I wasn't sure what I needed to do. I contacted the VA, and the VA prescribed a CPAP machine. I was really excited about the CPAP machine because I thought I would get over the snoring, and I was always worried about what most veterans worry about, snoring and all the conditions that come with snoring. And got the CPAP machine, started using it, and found that it was much too bulky. I was not sleeping, and I had to sleep on one side. That was the interesting thing, because I had the hose. I had a hose that went from my nose over, and I could only sleep on one side of the bed, basically, and it just wasn't working for me at all. And I talked with the CPAP team a lot about this, and they finally told me a little bit about Sleep Center.
Yeah.
And they prescribed Sleep Center. I came here to Sleep Center, and boy, did I make the right choice.
Oh.
Definitely made the right choice.
Well, thank you. Thank you. And so today, basically, you came in for an adjustment appointment. We're checking your device every so many weeks. You've gone through a couple of different types of our therapies, because when you were diagnosed, you're diagnosed with severe obstructive sleep apnea.
Yes.
So
severe.
Basically, you stop breathing right at 30 times an hour for 10 seconds or longer, with a drop in your oxygen levels
Yes.
below 90%. And that is a heart attack or a stroke waiting to happen, unfortunately.
Yes.
So there's so many health issues that tie in with this, obviously. So treating it is extremely important. And you've definitely done the right thing, and the VA has done the right thing, obviously, and I'm glad that they found us as well, too. We work very closely. We're a community care provider with the VA. We have the largest VA clinic in the country right across the street from our office, and so it's a wonderful relationship that we have. And I'm glad that you're a veteran, obviously, that's doing extremely well, just like most of the ones we're seeing. So let's talk a little bit about the therapies that you've had. And
Okay.
So with the mouthpiece, tell us your experience about this, because you had never worn anything in your mouth before, or?
Right.
Yeah?
Right.
Okay, so what was this? This basically is your traditional type of mandibular advancement device, which basically brings the jaw forward at night. It can go out further, but ideally we do not want to push the jaw very far at all. If anything, maybe to the neutral position, which basically where it is right now. So the little rubber bands help to keep the mouth closed at night so your jaw isn't falling open. And so tell us about how it was getting used to having something in your mouth at night.
Okay. Well, I do want to at first say.
Yeah.
I do want to first say, the CPAP machine, the bulky hose, cleaning it every night, turn it on, turn it off. This device is a wonder. This device is a wonder. You simply put it in my mouth, and I'll just kind of demonstrate really quickly.
Great. Easy peasy.
And done.
Very good.
It easily pops out, and this has been a miracle cure for me. I mean, if I could use those words, wearing this device, I can easily get some sleep. I could easily sleep comfortably, and that was the key for me, sleeping comfortably. I could sleep on either side; it didn't matter. I just pop it in and wait for sleep to wait for the Sandman, so to speak, to creep in. But this device works wonders for me, and I'm really happy to have this device.
So sometimes with patients, when they go into a device like this, because we're moving their jaw forward, that's the primary mechanism of action with these types of devices. These devices, by the way, have been around for like 40 years. They're, CPAP is the gold standard for treating obstructive sleep apnea, and these are really the close second here. There are other types of devices as well too that are actually more corrective, and VA has 100% coverage on these traditional types of devices here. So did you have any jaw soreness or teeth soreness or anything like that, like when you first started using this?
Well, initially I had to get comfortable wearing this device. I had just a little jaw soreness, and my teeth felt a little funny.
Yeah.
But after wearing it a week
Like
or week or so,
Yeah.
I felt very comfortable. No issues with my jaw. Again, easily pop it in, easily take it out. And I did want to mention cleaning it.
Yes.
Really simple. I'm just going to take it out. There's a case that comes with this. I'm just going to take it out, pop it in the solution, rinse it off, pop it in the solution, put it away.
Yeah.
And at night when I'm ready to go to bed, take it out of the case, rinse it off, and I'm ready to go. So this has been a wonder.
Very, very convenient. Yeah, same thing with travel. If you travel a lot, obviously traveling with a machine is
don't have to carry
cumbersome
that
and stuff.
machine with
You
you.
can put
Yes.
the device like this in your pocket and
Yes.
walk right through security and
Yes.
pretty much anywhere you want to go. And also it's not dependent upon electricity and things like that. So definite ease of use. So let's talk about the other procedures that
Okay.
you had done.
Okay.
So again, based on your severity, the device is a first line of treatment. However, with these devices, basically the guidelines around these, because these are every device that we use is FDA cleared to treat sleep apnea in our practice, either mild to moderate sleep apnea like these traditional devices are, or even severe sleep apnea. We have FDA cleared devices for severe sleep apnea as well too. That's currently not a covered expense by the VA, but we're definitely working on that. But in the meantime, we can do these other devices, and along with some of our adjunctive therapies to be able to help get you the best results. And so one of the other most beneficial therapies I can tell you that we offer patients, especially that are more moderate or severe,
Yes.
is the quiet night laser therapy, which is a CO2 laser that's same type of CO2 laser actually that we use on the face to help firm and tone and tighten the skin there as we age. We just use it in the throat and to firm and tone and tighten the tissue in the back of the throat. So one of the things that we do when you come in for your initial visit with your head and neck exam is we take a head and neck CT scan.
Yes.
Large field of view. You can see we're capturing from basically the top of the eye down to the base of the tongue, or about the third or fourth cervical vertebra here. And so as I zoom into this airway highlighted in the back, this is Kevin's airway. Okay, so blue and green are good, but when it gets into the yellow and the red part, this is the minimal area or the restricted area right here. So when we look at this is one view here. So we know that that's going to be probably the more restricted area, and more than likely the area that may collapse on him when he lays down to sleep at night. So one thing that we share with our patients is, this is a best case scenario. This is when you're standing up, awake and alert in a machine during the day, not when you're laying down to sleep. So when you're laying down to sleep, you have gravity, all this tissue can start to fall back. Again, you can have nasal obstruction, the mouth can open up, the tongue can fall back. So all of this area right here is basically the tongue. When you look at this line that I have drawn right down here, the bulbous tissue in the back right there, and where actually the minimal part of the airway is, which is about 5.5 or less than 6 millimeters for you right here, that is more than likely an area that's probably going to be collapsing on you at night, depending on especially what position you're sleeping in. So that's the soft tissue that hangs down the back of the throat. That's where the laser is targeted right there. And so basically, again, the functionality of this laser is to stimulate collagen production, which is going to tighten the tissue there. Less flabby, less vibration, much less snoring. Have you talked about that?
No snoring. I failed to mention that.
Yes,
no snoring.
I know, no snoring. So therefore, this is a 3-step process for most people. We go in 3 times, about 3 weeks apart. Yes. It's a 2 to 3 minute, 4-minute procedure.
No
okay,
pain.
So tell us about your experience with the procedure.
The procedure was pretty simple. No pain. I kind of sit back and just maybe a little just maybe a little
Scratchiness or
little
something.
scratchiness
Yeah.
in the throat.
Yeah.
After a throat lozenge, you're feeling just fine. But the procedure definitely has helped.
Yeah.
So,
So the snoring, your wife was.
the snoring is gone. My wife does not have to talk to me about snoring. And really, for us veterans, this is really important. I mean, no snoring. And that was a big deal. And I always felt unease about the snoring and how loud, but no snoring with this case. My wife would say, "Hey, you don't snore anymore. Everybody's good," and she's even happy that we're using the device and not a CPAP.
Yeah.
So that
Yeah.
procedure is definitely, and again, no pain. It's a
Yeah.
very simple
Yeah.
procedure.
We basically instruct patients that night stay away from spicy food, hot things that may irritate your throat. You might feel like you have a sore throat that night. Gargle with a little warm salt water. We give you a lozenge as well after the
Yes,
procedure.
you get a lozenge to go.
Yeah, and it already coats and soothes the throat, but it's really everything we do actually in our office is non-invasive. So we are pretty much the alternative to CPAP and surgery to help resolve obstructive sleep apnea or sleep breathing disorders, head and neck pain, TMJ disorders, all that type of stuff. So the third procedure that you had is the nasal release therapy, okay? So, or neurocranial release. So this is a procedure that is used in the nose. It's a balloon procedure. It basically helps to mobilize the bones and the tissues, allow the airway to open up better. Instantly you're breathing better, but most importantly, it's an osteopathic type of treatment. So again, it's non-invasive. What we're really addressing is helping to kind of get the fluids moving again well, so that whole cranial system working again for us. And so adjustment of the sphenoid bone, things like that. This is kind of a powerhouse thing to be able to do, but you really have to know what you're doing and do it in the right manner. If you're too forceful, you could seriously hurt someone. So based on the training that I've had with Cynthia Stein, I feel like she's honestly one of the best in the country to be able to be certified from. So with this type of procedure, what we're looking at here, again, when we took your CT scan, is now we're looking head on straight into the nose. These are the eyes up here, these are the sinuses, this is inside the nose, these are the turbinates right here, the grayed out area, and then the black is the airway there. The airway is very restricted and very narrow. Now this is just one slice here. As we move forward, we take other slices and we see, is there, is there deviation in the septum? Are there bone spurs? Are there chronic sinusitis? Issues of things like that going on. So we can help address the nasal part of the airway as well. So we're basically, at our initial visit, we're looking from the tip of your nose down to the base of your tongue at your entire airway. We're looking to see what might be causing the root problems of the issues that you have that can affect your breathing and sleep at night. So this is a common therapy that we do for a lot of patients to help reset, basically helping reset the autonomic nervous system for us and get us more into a parasympathetic state of rest and digest and sleep at night. So a lot of things can be improved upon as we do that procedure. So today we did that procedure actually for you. That's for you based on your anatomy and history. This is also, might I add, a great therapy for post-concussion syndrome. So a lot of veterans have concussions, blast wave traumas, things like that, firing guns and things being detonated, all that type of stuff, happening. These micro traumas basically stack up in the head. And as I often describe to veterans as well too, is I was like, imagine your gun jamming on you, okay? and one said the other day, oh, your gun never jams. If your gun jams, you're in a big problem. And I was like, well, your gun's jammed, so what are we going to do to unjam it? So this is a way of helping, again, getting the tissues moving and everything in a non-invasive way, very gentle and everything to kind of reset the system. So what has that procedure been like for you since we've done that a couple times for you now?
It has definitely opened my nasal passage. It's an interesting procedure, but you feel better. Your breathing is where you're breathing, you can really tell that the procedure is working. I just feel no blockage,
Instant breathing, yeah.
You just kind of get through the procedure and no blockage, and I really feel good.
Yeah.